got my pipe packed, ready to go. This weekend has been hilarious, absolutely hilarious, and you've been blowing our Telegram up like a friggin' lunatic. But this morning, I think what we're gonna start off with is monkeypox. Monkeypox. What do you think about this new disease that's ravaging our land?
Well, if I actually knew much about it, it would be great. And if I actually believed the mainstream media, it would be even better. And if I hadn't actually just lived a psychological operation against the world called the COVID-19 pandemic, I might not be particularly cynical about its validity. But that's where I'm at.
So yeah, guys, you've probably seen some of the stories that dropped this weekend. If you hadn't, we put some of them in our Telegram feed, but they've got literally reused pictures of old pictures that were shown in 2018 claiming it was a monkeypox case. That picture being reused for, just a couple days ago, saying that it was like the third case or something like that in New York. Well, no, New York City patient tests positive for virus related to monkeypox, with officials urging people to wear masks. And whatever protective gear, hazmat gear you can get your hands on. But it's literally the same picture. And then in another place, they pulled a picture of shingles off of a medical website and inserted that as another case of monkeypox. And at this point, I'm not sure what you pull from it other than the fact that we are being messed with in one gross fashion. And I'm done with it.
And I wonder why they're using monkeypox, because it's not particularly, historically at least, a overly alarming disease. Obviously, it's not good, but it's not a particularly alarming one. And Bill Gates and everyone has been out there claiming that the next pandemic's going to have a much higher death rate, et cetera, et cetera. So I guess I'm just a little surprised. I mean, is this the result of Putin's involvement at Ukraine and shutting down all the U.S.-funded biolabs, or is this something else? I just don't understand why monkeypox is the go-to.
I don't know. I mean, they must have previously thought that this was something that worked as a good narrative, like a good scare tactic. I have no idea. I mean, they're clearly recycling something that's over 5 years old. Well, no, 4 years old now. So I don't know. I don't know why. I just know that if you have stories that are literally like taking pictures of different diseases and inserting them as this new wave of monkeypox that's coming through, we're being messed with. And I don't know if you ignore that or what. I don't even know what to take from it.
Well, it's tragic because this is a case of deception and fraud, material fraud that will affect us massively economically. It's interesting as an ex-investment advisor to think that you can't misrepresent anything about any of these financial metrics, or it's material misrepresentation, and you could be civilly or criminally fined and or put even in prison, depending on the extent of it. It's fascinating how strict they are about this stuff, but we have no recourse for what Donald Trump Jr. put out here, where he's showing pictures of them just having these, basically taking a false picture of something that applied to shingles from the Queensland government health website, and then using that as a picture of monkeypox. It's deception. It's false. Same thing with the other story you mentioned. The Independent 2 days ago put out that this was a picture of monkeypox, when it's a picture of monkeypox from 5 years ago in the UK.
If it's a picture of monkeypox.
Yeah, if it's a picture of monkeypox. Who knows, right? So, it's the fact that we know this, though, that is one of the most intriguing pieces of the puzzle, that we all know this is a game at this point.
Well, and then to do something this flagrant, is the intent here to actually completely destroy the people's trust in their medical system? And if so, how do they benefit from that? I mean, because they've got to, this seems too, because you probably could have hired some people to do some CGI and actually do some new pictures. I mean,
Yeah, this
was too easily identified as fraudulent. So is the point to actually destroy the trust, or is the point to push another virus? Because I mean, this seems more like they're actually trying to just break the people's trust in the medical system down further.
It might be both. I mean, a lot of people have missed this, but part of Agenda 2030 is the reduction in medical services, and hence the desire to come up with vaccines. Because if you study the mRNA technology that the vaccines, these recent vaccines that were put out for COVID-19, they're designed to basically, in theory, make the body its own. Basically, it's supposed to make it this like white blood cell, just dominating machine that's supposedly going to be able to react to that virus plus many others. But it's interesting that they want to depopulate, but part of that process is also reducing medical services and the public's access to them.
All while pushing us further and further into city centers. I mean,
I mean, that's basically a massive surveillance while the solution is to increase massive vaccines, reduce dependency on traditional medical, and remove access to traditional medical, bring everyone into surveillance type situations where they're assigned their roles, right? And they don't own anything. And so they're part of the cog in the machine, and part of that process is something like, and everyone feared this with Obamacare years ago, and of course, we all knew this was in the background, but something like death panels. So when you can no longer be a contributing member of society, then you would need to be just removed rather than basically consuming medical resources, expense, etc. Right? That's not good for the flourishing of humanity. They would probably argue.
Yeah, I mean, people were clearly being lied to. We're clearly being jerked around. What angle you take with this, I don't want our trust to be completely destroyed in the medical system. We need it to function properly. But I also don't know how to trust the medical system right now. It's one of those, like, if they're going to be pumping stories out like this, it's one of those things where we clearly have to retake control of this one. Or else, I mean, what are we going to have in the future?
Well, I mean, it's bad. I mean, and this hasn't been spoken about enough, but if you look at the vast majority, not all of them, major exceptions to this, right? Dr. Zelenko, frontline doctors. Yeah. So there's a lot of examples. So understand that there are exceptions to this, and there are real medical heroes, and we, applaud them. But the Hippocratic Oath is about doing what's best for basically your patient, and protecting their privacy is part of that as well. And if you just look at how the vast majority of healthcare professionals utterly flipped on that, with just adopting, I'm going to call it almost a fascist government rollout of something forced on the people, they all just stepped in line. Hippocratic Oath meant very little. And of course, as you would say, that's a big item for me to want to trust you. I have to fundamentally believe that you have my best interest in mind, and that you're going to protect my privacy. And the vast majority of healthcare professionals involved in the vaccine rollout utterly betrayed that, because they said you don't have a right to medical privacy by basically requiring you to disclose your vaccine status. And then secondly, they may or may not have my best interest in mind, because there certainly is much competing data. And at this point, it shows that we were right. We've been talking about this for over a year now, that these vaccines are not effective, and that they actually impair the immune system on the whole and make you weaker, and therefore are against your benefit. And how many doctors just said, no, let's trust. I guess they trusted the government more than they cared about their oath, might be a good way to say it, if they even trust it. I mean, some of them just don't even care about trust or truth or anything. They're just doing what they're told to get a paycheck. Probably many of them, actually.
And one of the best ways to fight against this is being done by, I mean, a good example, at least in my own personal life, is a friend of mine locally here, and I'm not gonna say his name or business name, but he went ahead and broke off from the traditional medical system and started one of those, subscription model medical care, like general, I guess general doctor or like family doctor practices, where they don't take insurance and all that. They're a subscription service. And his business is exploding the last little bit. He just recently opened a new office, and I mean, that business model has been fantastic. He's somebody that I trust, and I suppose, if you guys in various locations have doctors that you trust and they're still in the traditional medical system, try to support and encourage them to break off and do a similar model, similar general practices and more specialized practices too, if they can, so that we do have smaller businesses to go to through whatever's being done to us, that we can trust. And he's one that Lauda and I trust. And yeah, I mean, it's kind of a relief to have somebody like him around. And I hope we can expand that kind of that kind of influence or movement in the medical system in more communities. I think that's a fantastic model. It's one that we need to expand on, because the traditional medical system is clearly going in a direction that I'm scared of. Like, I'm actually scared of going to the hospital now. Like, me personally, I haven't had the COVID vaccine, so that's another one of those things. It's like you end up in a place like that, and then have to say, no, I haven't taken it. And with as hostile as these guys have been towards people like that, it's kind of like, it's like, what's going to be put in my IV? And again, possibly incendiary sounding, but I've had thoughts like that with as kind of violent as a lot of the language has been towards those who aren't taking the vaccine. It's kind of like I end up in one of those facilities and they know I haven't. It's like, I do not trust them. I do not trust them.
Even here in Florida, my wife went to take our kids to, and I think I told you about this, Aaron, but just an urgent care. And they were emphatic about wanting to give them COVID tests. And, my wife just left with our kids. But, I mean, and this was just a few months ago, like.
I know. And there's been stories about people who need cancer treatments and different surgeries being turned down in locations because they didn't have the vaccine. And it's just, dude, that's disgusting.
Well, yeah, it's a total violation of their Hippocratic oath. Again, going back to that. Yeah. Now you have no right to privacy, and when you disclose that privacy, they're not going to follow their oath and do what's best for you. They're going to screw you.
No right to privacy, and apparently no right to care.
Right. Well, yeah. So I mean, total violation. Going back to the Hippocratic oath. I mean, that's not a small story. It's kind of it's been dead for a long time, and frankly, I got just sick of talking about the pandemic. I was talking about the pandemic for 9 months straight, just doing all the gritty detail and research. But I mean, here we are again. They're trying to push, and that's what's happening, friends. You got the midterm elections coming up. You've got Agenda 2030 working in the background, and you've got massive attempt, which is going on right now, to somehow subvert 94 nation states and put them under the medical authority of the WHO. So those are kind of the three major currents that are all coming together with why they are trying to push this monkeypox hoax. And I'm calling it a hoax because I don't know if there's no cases or if it's false or it's true. It doesn't really. Beginning and end of the day, the way that they're trying to push it with fake pictures is the hoax part. And then that it could be super alarming might be the other hoax part, right? I mean, who knows?